Hi everyone, welcome to Medicine Note YouTube channel. In this video, we are going to see about Hemophilia A. Hemophilia A is a hereditary clotting disorder due to the deficiency of coagulation factor 8. It is an hereditary clotting disorder which is characterized by the deficiency of the coagulation factor 8. It is due to the deficiency of coagulation factor 8. Hemophilia is a X-linked recessive disease, hence the males are usually affected. This hemophilia is X-linked recessive disease. Mostly the males are affected, and this is because the females have two X chromosome. Because males have X and Y chromosome, so they are mostly affected. But in females, they have both the X chromosome. Due to that, the one X chromosome compensates the others. This is because the female has two X chromosome, and even if one affected, the other one compensates. However, rarely the female can be affected if their normal X chromosome is also disproportionately inactivated. In rare cases, the female can also be affected if the one X chromosome of them is getting disproportionately inactivated. So sometimes the females can also get this hemophilia. 1 in 10,000 is born with the deficiency and the dysfunction of the factor 8 molecule. This hemophilia is caused due to the deficiency or dysfunction of the factor 8 molecule. In 10,000 people, males, the one male can be has a deficiency or dysfunction of the factor 8 molecule. Pathogenesis. The factor 8 is a large single chain protein that regulates the activation of the factor 10. This factor 8 is a long single chain protein molecule which is used in the activation of the factor 8. These factors, there are many clotting factors. In that, one clotting factor is 8 and the other one is 10. This factor is used in the coagulation pathway. Clotting mechanism by intrinsic, that is divided into intrinsic as well as extrinsic mechanism. In the intrinsic mechanism, this factor 8 activates the factor 10 with the help of an enzyme protease. When this factor 8 is deficient, there is no activation of the 10. So this 10A is generally responsible for the clotting mechanism of the intrinsic pathway. When there is no activation of this 10, which leads to the deficiency of the clotting mechanism. It is in the pathogenesis. Due to that, the factor 8 is a large single chain protein molecule that regulates the activation of the factor 10. But by protease, the generalized intrinsic pathway, hence the deficiency of the factor 8 leads to the defective coagulation and bleeding. The factor 8 is synthesized in the liver, but this factor 8 is synthesized in the liver and circulates in the blood by 1 milligram factor. And it acts as a carrier of the factor 8 in the blood. This 1 milligram factor acts as a carrier of this factor 8 in all over the body. The clinical feature. The hemophilia A is the second most common congenital hemostatic disorder. The first is 1 milligram disorder. It is a severe clotting disorder. Family history of the hemophilia is usually positive because it is a X-linked recessive disease. Now the bleeding tendency is related to the factor 8 level. The patient with mild hemophilia bleed only after major trauma or surgery, with moderately or severe hemophilia with mild trauma or surgery. Bleeding can occur anywhere. Commonly it occurs in the deep tissue such as joint and muscle and front of GIT. The bleeding into the joint is commonly in hemophilia A, and it is the most diagnostic of the disorder. The investigation. The partial thromboplastin time is prolonged. The platelet count and the PT, which is prothrombin, are normal. The platelet count as well as the prothrombin level are normal. Factor 8 level is reduced. Bleeding time and the fibrinogen level is normal. The treatment of the hemophilia involves the infusion of the factor 8 concentrate either by recombinant technology or the heat treated one. Hence, there's gene therapy also currently introduced, but it is in the developmental phase. Avoid the use of aspirin in the hemophilia patient because it is also an anticoagulant which disturbs in the clotting mechanism. Thank you. If you like this video, please to like, share and subscribe my YouTube channel. If you have any doubt on it, comment it. If you want more videos, please to subscribe.